Welcome to Home Aid Training Center. We are based in Federal Way, Seattle, Washington, United States of America. I'm the community instructor for this institution, and today in our lesson 1 we are going to talk about mental health for capable caregiving for mental wellness level 1. And therefore there is a lot to learn in this lesson or in this module, and therefore I want to request you to be well prepared, prepare your mind, because we really need you to go, when you go out, to be able to serve our community in the best way possible, because we train skills for life, and I believe that the much knowledge that you acquire from this institution gonna help you to be able to go and give the best services to that is much needed by our community. And therefore join me. This is a learner-centered class, meaning we're gonna engage each other so that we can be able to get most and dig out of this, and I believe you're going to benefit. And therefore the objective of this course to a caregiver and home care providers is that they can be able to review the definitions, be able to tell common signs and symptoms, and be able also to identify types of mental illness. And therefore this first lesson we are going to be learning about mental disorders. And therefore what you're saying here is that mental disorders are biologically based on brain disorders. Mental disorders are biologically based on brain disorders that can greatly interfere with a person's thinking, feelings, mood, a person interaction with other people, and also capability to cope with the demands of life. So people suffering from such disorders are prone to depression. They are also prone to anxiety. They are also prone to emotional distress, and they are also, they have difficult when it comes to interpreting and rating substance abuse, creating an increased need for medical and social support to stabilize or recover from those disorders. So in other words, we are saying that mental disorders, they will interfere with the way a person thinks. They will interfere with your emotions. They will interfere the way you are going to relate with other people. They are going also to interfere with the way to cope with the challenges of life. So that is what we are talking about here. So what we're trying to say here is that in a given year, 43.8 million people or adults, they experience mental illness in a given year. Just imagine, that's a big number. And what we also notice here is that 1 in 5 adults in America, they experience mental illness. By every 5 people, one of them experience mental illness, and nearly 1 in 25 adults in America live with a serious mental illness. So you can imagine that ratio. So approximately 10.2 million adults have co-occurring mental health and addiction disorders. So the National Alliance and Mental Illness have additional information available on mental illness in www.nami or NAMI.org. Learn model mental health by numbers. In spite of these statistics, we'll find that many people, they remain unaware of significant number of adults who have mental disorders. So many adults who benefit from treatment, they never get it, because if you don't identify identify a problem, or somebody has a mental illness, then you cannot give treatment to what you do not know the symptoms, you do not know what could be the cause. So why is all this? Mental disorders are challenging to diagnose, so it's not easy. It is not easy to know that somebody is suffering from mental disorder. So what are the symptoms? So the symptoms of mental disorder, they vary along range, and there is no exact line that separates health from disorder. So that's, we are talking about the normal health and the mental health. Those are they are two things. So often people, they tend to focus on the extremes and defining mental disorders only by most severe symptoms. So if the symptoms, they are not they are not discoverable, then not many people who tend to know that they are suffering, somebody is suffering from that condition. And therefore a mental disorder can be difficult to acknowledge. Not many people who accept, so that means that they suffer from a stigma. So many people wait until their symptoms are severe or they worsen, and before they seek for help. Some people, they will never ask. So that means that many people, they would rather keep quiet with their mental condition instead of talking about it. So like cancer and diabetes, mental illness is a medical condition that may improve. This condition of mental health, it can improve, or just like cancer and diabetes, cancer can improve or worsen. Diabetes can improve or worsen. So with the mental health also, it means that it can also get better, or it can get even worse based on care and treatment. So two things: care and treatment. What are you giving this person the right care, or is this person receiving the right treatment concerning the condition that he or she may be having? So when you're working with the people with the mental illness, you remain compassionate to people as individuals, and realize that people who suffer from mental illness may behave or communicate differently in ways that may be confusing. So you are supposed to treat them with like normal adults, and though you know, and you might be aware that they are suffering from mental illness or such kind of condition, you are supposed to treat them with the respect and with the dignity, so that you can be, and you just know that their behavior may be not what you expect, you may not be what you will like. Sometimes they will become agitated, sometimes they are unpredictable behavior sometimes, and it's good that when you're working with them, you understand them and you treat them with the compassionate. So, and then more information we are going to look when it comes to lesson number 2. And keep in mind that despite symptoms, behaviors, causes, and treatment, each individual is unique and should be treated as an individual rather than a disease or a diagnosis. So don't treat people because of their condition, but treat them like human beings. Treat them with respect. Treat them and give them the much needed care, because if you don't give them, who is going to give them? Who is going to give them this care? So this is what we are talking about here. So how is the mental health, mental disorder diagnosed? How do you get to know that a person has a mental disorder? So it is not the caregiver's job to diagnose a person with a mental disorder. So you as a caregiver or a long-term worker, it is not your business to know whether a person has a mental disorder or not. It is not a job. So to diagnose a mental disorder, the person has to discuss his or her symptoms with a licensed clinician. So it is work of the licensed clinician to discuss about mental disorder symptoms with the client, but it is not the work of the client or of the caregiver to do that. So the clinician will perform a mental status exam. So this licensed clinician is the one who is going to conduct a mental status exam and observe the person's behavior. The clinician studies the person's symptoms and behaviors and reviews their illness and treatment history to determine if the if grouped into a pattern or is a syndrome. So even the licensed clinician will look at the history of the treatment. We also try to give this person a mental exam, and also try to look into what are the symptoms. Does he fall under that category? So these are some of the factors that the clinician is going to look into. So if the pattern or the syndrome meets the criteria for specific diagnosis, the clinician will make a diagnosis. The diagnostic exam is generally conducted in a hospital setting, such as a psychiatric or in a medical hospital. So this is not performed in an adult family home, or is not done in a rehabilitation center, but it is done in a mental in a hospital setting, whereby medical hospital such as psychiatrist or medical hospital, in an outpatient setting such as a medical clinic or a mental health clinic, or in a clinician office. So that is what probably we need to understand. So a diagnosis is not always the answer to someone's care needs. So even if the client is diagnosed from the condition, that does not mean that it is the answer to the care needs. No. Avoid focusing on one's diagnosis when providing care to an individual. It does not mean because the results or the outcome of the diagnosis of the mental exam predicted that the client has a mental illness, that is what you're going to focus into when providing care. Care should be provided to the best standard, to the best quality, and it is always good as a caregiver to ask yourself by the end of the day, did you do your job well? Did you provide the care that if you are the one who was in that condition, whether you will receive the same type of treatment. So for example, an individual diagnosed with the depression may have panic attacks or symptoms that do not always match with the diagnosis. The key is always to be flexible how care is provided. Be flexible and show that you really care and you are concerned and you're not focusing on the illness, rather than you are focusing on the client's need. That is what you're supposed to do. So what are some of the challenges? Many factors that make mental disorder challenging to diagnose is, number one, you write this down, is unlike other medical issues, there is no blood test. You know, when you do blood works, you can always tell if there is a problem or not. So for mental illness diagnostic, there is no blood test or physical exam that can determine if a person has a mental disorder or not. That is what complicates mental illness diagnosis. Number two, symptoms vary along continuum. So the symptoms, because each individual, remember, they will behave differently, they are unique in their own ways. So changes often are not always visible. So when the changes are happening, then it is not always easy to notice what is going on. The healthcare provider does not always witness the symptoms. So the healthcare provider, he is not the one, because he's not always with the client. So the person who is the client most of the time is the caregiver or the long-term worker. And remember, it is not, we said in the beginning when we were starting this lesson, that it is not the work of the caregiver to diagnose the client whether he has mental illness or not, but we say that it is work of the licensed clinician to be able to diagnose these problems. So the person may not always be fully open or truthful or aware of what is happening. Either the client will not tell you the truth about what he or she is experiencing, or whatever is happening is true, or he sometimes may not tell you the truth, or sometimes even him or herself may not be discovering whether he has mental illness or he has the signs that can prove that he has a mental disorder. The person also may not always be each person's tolerance of symptoms varies. So that means there's a person who can cope for a long time with the signs of mental disorder, and another ones they cannot be able to tolerate such conditions. So those are some of the challenges when you talk about the mental disorder. So also, there may be more than one disorder present, or because of the coexisting conditions. If the conditions they are not good, if somebody has a depression, or somebody is in a certain way is not receiving the proper care, then there is a problem right there. So we can also see that a client can also do what we call self-diagnosis, trying to find. So with the availability of so much information on the internet, it is easy to look up symptoms and self-diagnosis and illness. When you self-diagnose, you are assuming that you know the subtales of the diagnosis. For example, people who experience mood swings, there are people who experience mood swings, might self-diagnose, might self-diagnose bipolar disorder. However, mood swings can be a symptom that can be part of many different scenarios. It can be a sign of many different scenarios. So, a professional diagnosis may identify other disorders or even another medical condition such as hyperthyroidism or irregular heartbeat. Self-diagnosis can confuse the proper diagnosis. So when you diagnose yourself is not the same than when you would be diagnosed by a licensed clinician who is a professional in that field. So these are some of the things that we are looking into, and therefore our next subtopic is on stigma and myths. Okay, there are long history of stigma, that misunderstanding, false beliefs. When we talk about myths, we are talking about false beliefs. Those are things that people believe, that they believe in things that really don't exist concerning this situation. So this is a confusion surrounding mental disorder. So what is stigma? So stigma related to mental disorders can greatly influence whether a person will seek treatment. So, and stigma is defined as a sign of shame and disgrace. That means if you are experiencing signs of mental disorder, you really don't wanna feel like you are going to you are going to disclose to your friends or people who are taking care of you that you have got signs of mental disorder. So that is signs of shame. You are ashamed. You feel like you are disgraced because of a condition. So many people, they feel too ashamed or embarrassed to talk to anyone about what is happening, and they may try to hide these symptoms. So if they have mental disorder and they try to hide, then there's a big problem there. So stigma is so powerful that it can also affect the relationship with the family members and contribute to the disorder being viewed as failure on part of the entire family system. So not only these clients who hide the symptoms to the caregiver or those close who are taking care of them, but they also try to hide from the family members, and this may cause more problem. So stigma also affects how others treat a person with mental disorder. Evidence that stigma exists can take many forms. So it can take many forms. So number one, treating the people with the disorder with the disorder as disorder. That is very, very wrong. So if you have that, if you notice that somebody has mental disorder, we have said in the beginning of the lesson, don't focus on the mental disorder. You are supposed to concentrate on care and meeting the needs of that client. That is what you're supposed to focus into. The other thing you're supposed to do is treating the person, for example, thinking and talking about the person as schizophrenic, not as a person who is living with the schizophrenia and has a family. This person has a family, has dreams, and has abilities, regardless whether he has mental disorder or not. Number two, thinking there is something essentially wrong or bad or dangerous or weak about the person because he or she has a mental disorder. It is very, very wrong. So this is what we are talking about, the stigma. So this is a really, really serious thing. So when you think that something is seriously wrong or is bad or that somebody is dangerous or is weak because of his mental disorder, that can also make somebody feel ashamed or disgraced to talk about his condition. Point number three, thinking the person is personally responsible for his or her condition. There is nobody who wishes to have a mental condition or mental illness. We all of us want to feel like we are doing at our best. Our dreams are valid, they are important. We have a life to live, and we want to, all of us want to live in our normal lives. So number four, using offensive and insulting language to refer to a person as a lunatic. Use foul language, which is very, very wrong, because you're supposed to treat every person with respect, even if sometimes their moods and their behavior, they may not be very good to you. That does not mean that you're supposed to stigmatize them by calling them names like lunatics or nuts or go away, you are crazy person, you are clear, or you're psycho. This is very, very wrong. Point number five, thinking bad parenting causes mental illness. So we think that probably because of bad parenting, maybe the mother or the father was a drug addict, and thinking that probably a client has a condition because of that. That is very, very wrong. Now, the third part that we're going to talk about is about stigma and caregiving. So stigma can prevent caregivers from providing the best care they are capable of giving. So if you are a caregiver, you believe somebody has misinformation about people with mental disorders, what are you supposed to do? If you have some misinformation, let's say you've been employed in a new facility, in a new adult family home, and the information that you've been given about the client is true, or you've been given misinformation, then there is a problem right there. So number one, what is going to happen? You are going to be uncomfortable in helping that person. That is number one. Number two, treat the person differently from other people with other illness such as cancer or heart disease, and therefore misinformation is a very bad route to go when it comes to helping people with mental disorder. Okay, let the fear of the person mental disorder let the fear of person with mental disorder stop you from finding new ways to understand and relate to the person. So whatever information you are given, whatever history you read, you are given about the person's behavior should not be able to lead you to treat people differently and in a long way. You are supposed to treat people with respect, and that is what you're supposed to do. So the other thing you're supposed to do is to make sure it is important not to allow stigma to impact your caregiving activities. The best way to help separate yourself from the stigma, you as a caregiver, because here we are talking about the caregiver and we are talking about the client who has a mental illness. How can you separate yourself so that you may help this person or this caregiver who has this situation? So you can separate yourself by, one, learn the facts about various mental disorder. So this course is a good start. So when you learn their behavior, you learn about the symptoms, you learn about how to deal with them, then it will put you in a place where you'll be able to give them the best care. So number two, talk and think about mental disorders in the same way you would talk and think about other illnesses. So because there are other sicknesses like diabetes, high blood pressure, cancer, stroke, all those, the way you talk, you're not, you don't want somebody to feel disgraced or humiliated because of a condition. So number four, challenge people around you who reinforce myths, who receive false beliefs. You talk about them, and stereotypes and misunderstanding about the mental disorders. And also lastly, and the other point, be supportive of people with mental disorder, so that you can be able to support them and give them the best care. So you just learned about a man who will soon be in your care, named Shaud Wakeoff, and he's 76-year-old man with schizophrenia. You have no other information yet on Shaud, but you have heard that schizophrenia makes people dangerous, violent, and unpredictable. What can you do to separate yourself from this stigma so that you can provide the best care possible to Shaud? And that's what we said, that you're supposed to separate yourself. That is what we said. Remember, we said that the way to separate, we just said that the best way to separate yourself with the stigma of how you deal with the people with mental disorder, we have said, number one, talk and think about mental disorders in the same way you talk and think about other illnesses. That is number one. Number two, learn facts about various mental disorders. So, and we have started very well with this course so that we can provide you with the necessary knowledge so that you'll be able to know how to deal with them. And also say that challenge and question your attitude. You challenge yourself, your attitude towards mental disorders. How can you be of help to that person? How can you treat them with dignity and with respect? How can you deal and provide care to them without making them feel ashamed and disgraced to speak about their condition? So those are some of the things. And then lastly, we say that it is good to be supportive to people with such conditions. So what are the myths and the facts, or what is the truth between false beliefs and myths about mental illness? So there are many myths and mental illness, myths around mental illness. And you may hear myths, these are false beliefs about mental illness from family, friends, co-workers, and even in media. It is important to stop and you suspend your judgment and realize that mental illness is a medical condition. So it's not about myths, it's not about false beliefs. Yeah. So number one false belief is that mental disorders are rare. They are not common. That means that's a myth, a false belief. They are common, and we saw it when we were beginning this lesson. So what is the fact? Mental disorders are very common. That is the fact. So myth, the definition of myth is false belief about something. And when you talk about fact, we are talking about what is the truth. The truth is what we are talking about. So mental disorders are very common. in a given year, 43.8 million adults, they experience mental disorder or mental illness. And we also say that 1 in 5 adults in America, they experience mental illness. That is what we said. And then we also say that nearly 1 out of 25 adults in America, they have got serious mental illness. So that is the truth, and you cannot run away from the truth. So we have to separate between false beliefs and the facts or the truth. So another myth or false belief people spread is about that people with mental disorders are violent, dangerous, and unpredictable. That is myth. It doesn't necessarily mean that simply because a client has a mental disorder or has a mental illness, it doesn't mean that that client has must be violent or must be must be dangerous or maybe having unpredictable behavior. That is a false truth. And then the fact is that majority of people with mental disorders are no more likely to be violent than anyone else. Individuals living with serious mental illness account only for 3 out of 5% of violent acts. So you see the difference there. So it doesn't have to be necessary that people with the mental illness that they have, they are always dangerous, they are always unpredictable, and they are always violent. No. So again, another point, another truth is that people with mental disorder are more likely to harm themselves. If they have a mental condition, instead of harming you, they harm themselves. It's more likely they are going to harm themselves or be harmed than they are to hurt other people. It doesn't have necessarily to mean that they are out to harm you as a caregiver. It is most likely they will harm themselves or they will be hurt themselves. A person with schizophrenia is approximately 2,000 times more likely to commit suicide than they are to harm someone else. You can imagine. So 2,000 times possibilities of committing suicide, somebody with schizophrenia. So it's good to know the truth, to distinguish or differentiate between the truth and myths. And then something else we can say is a false truth or is not true is that bad parenting causes mental disorder. That is not true. So mental disorder is not caused by bad parenting. That is false truth. And what we can say concerning that is that mental disorders are biologically based on brain disorders. They are not as a result of person's weakness or lack of character or poor upbringing. So poor upbringing or lack of character or bad character, they do not cause mental illness. So another false myth or false about mental illness is that personality or weakness or character flaws cause mental disorder. People with mental disorders can snap out of it if they try hard enough. That is false truth. So we are saying the fact is mental disorders have nothing to do has nothing to do with being lazy or being weak. Many people need help to manage their illness. You just guide them as a caregiver. You guide them. Show them the way, show them the direction, they're gonna do well. Many factors contribute to mental health problems, including biological factors. So there are so many things that lead to mental illness. Among them, there are genes, there could be illness, there could be injury, could be brain chemistry, life experience, abuse, trauma, or family history of mental illness. So those are some of the things that we could say that is the truth, but we are not supposed to judge someone or think that probably or believe that the personality of a person, weakness or character flaws that can cause mental disorder. So another lie or another myth is that or false belief is that talking about suicide to a person with depression increases the risk that he or she will do it. So that is also a lie, that you don't want to discuss about suicide to somebody with the depression because you have fear that that person is going actually to commit suicide. What is the fact? Talking to someone about suicide actually decreases the risk that that person will try to take their own life. So the way to help here is to make sure you discuss whatever is affecting the person with this condition. That will decrease. But when you don't discuss them and then they keep quiet on themselves, then they have even higher chances of taking their own life. But if you discuss with them, it means that you are going to help them and decrease the chances of them committing suicide. So that is what we are talking about here. So then, what we can say, that often we are fearful of talking to someone about their desire to kill themselves because we are fearful that they will we will cause them to commit suicide. But in reality, most suicidal people desperately want to live, but they are unable to see alternatives to their problem. So talking with someone helps, and we have not seen that, and I think I personally have witnessed that many people that I've talked with during my counseling sessions, then because it's somebody with who has suicidal thoughts, is somebody who has come to an end of the road, and it's somebody who is contemplating about their taking their life. But when you discuss with someone, it opens their mind. It helps them to see life in another dimension, and that may decrease chances of someone killing themselves. You know, and it means a lot when you talk with the people, because most of the people with suicidal thoughts, they feel unloved, they feel unwanted, they feel the world never cares for them, they feel that nobody understands them, you know. But even a smile, and even to show love, to show care and concern to a person, it can save a great deal to somebody who want to kill themselves. So these are some of the things that we're gonna discuss when it comes to mental illness. And we are going to conclude our lesson, or to take a break. We are going to take a break before we come to lesson 2 for mental illness, by discussing about mental health conditions. That is what we are going to go to break with, and I believe that you will be able to have evaluation of the knowledge of what we have learned by taking some lessons, some questions, or some assignment, so that we can be able to evaluate ourselves whether we have acquired the right knowledge on that part or that segment. So the following are mental disorders outlined on the following pages. The list does not include all mental disorders, and some of the disorders listed may be more common than others. So this is not all, whatever is listed here. So number one, they can be found in the National Institute of Health, or National Alliance on Mental Illness, or National Institute of Mental Health .gov. Number one, kind of mental health condition. Number one is attention deficit hyperactivity disorder, ADHD. Attention deficit hyperactivity disorder, ADHD. So that is one of the condition. Another one is anxiety disorders. That is a mental condition. Another one is autism and spectrum disorder. Another one is bipolar disorder. The other one is borderline personality disorder, BPD, borderline personality disorder. And another condition is depression. Another one is dissociative disorders. Another one is eating disorders. So another one is obsessive compulsive disorder. There is another one called post-traumatic stress disorder. Post, you know, after something has happened. Let's say there was a bomb. Somebody was in a building that has that had some bomb, explosion or a big explosion. So after that, that person needs to go through traumatic counseling, because there is post-traumatic disorder that comes with that. So every time you hear a loud noise somewhere, you tend to think that the same experience, the same explosion that happened is repeating itself again. Another condition is schizoaffective disorder, and there are also related conditions like anosognosia, duodiagnosis, psychosis, risk of suicide, self-harm, sleep disorders, and substance abuse. So these are some of the mental conditions that you need to be aware of. It's not listed every one of them, but we are going to look at each one of these conditions that we have mentioned here one by one. But remember that it is not your job as a caregiver to diagnose mental disorders. That is the big thing that we have learned in this lesson. Is not your job as a caregiver or long-term care worker to diagnose whether a client has a mental disorder or not. It is the job of licensed clinician to discuss, and this happens in a medical hospital setting, like a psychiatric, or in a mental hospital. That is where this all happened. It is your job to be aware of mental health conditions, so when you understand the mental health condition of the clients that you are taking care of, you'll be able to understand them better and make better decisions concerning their care. So when you're providing care, it will bring the best outcome if you are going to understand them, to understand them and provide to them and give them the best care as possible. This is Home Aid Training Center. This is the class for mental health, lesson 1, and I believe that you have really benefited, or you are benefiting from all that we are giving here as we continue with this lesson. See you in lesson number 2. Thank you, and see you later.